Hello my dear viewers, welcome to AI Medical School. In this video we are going to discuss about Misoprostol drug, but before start the video, please subscribe to the channel and like the video. Let's get started. Misoprostol is a synthetic, oral prostaglandin E1 analog and exists in 1:1 mixture of two diastereoisomers. Misoprostol is used for and is commonly believed to be effective for prevention of gastric and duodenal ulcers secondary to use of nonsteroidal anti-inflammatory drugs, although currently misoprostol is indicated only for the prevention of gastric ulcers. While misoprostol is approved for use in preventing NSAID-induced gastric ulcers in high-risk patients and it has been shown to be superior than sucralfate for this condition, uncertainty exists regarding the role of it in patients receiving NSAIDs. Independent of NSAID administration, it has been used as a therapeutic agent in the treatment of active duodenal and gastric ulcers, although misoprostol is slightly less effective than H2 antagonists. It was approved by the FDA in December 1988. It inhibits basal and nocturnal gastric acid secretion through a direct action on the parietal cell. Parietal cells contain receptors that have high affinity for prostaglandins of the E series. It can inhibit gastric acid secretion secondary to stimulation from food, alcohol, NSAIDs, histamine, pentagastrin, or caffeine, and this effect appears to be more pronounced with increasing doses. HA antagonists, however, appear to be more potent than it in the ability to inhibit gastric acid output, especially at night. Now the indications. Misoprostol is primarily indicated in conditions like benign gastric and duodenal ulceration, hemorrhage, peptic ulcer, prophylaxis of NSAID-induced gastric and duodenal ulceration. And can also be given in adjunctive therapy as an alternative drug of choice in termination of pregnancy. Side effects of misoprostol. The symptomatic adverse reactions produced by misoprostol are more or less tolerable, and if they become severe, they can be treated symptomatically. These include flatulence, dizziness, headache, diarrhea, abdominal pain, skin rashes, cramps, hypotension, nausea and vomiting, dysmenorrhea, hypermenorrhea, spotting, skin rashes, dizziness. And the warnings are: do not take misoprostol during pregnancy or lactation, because it can cause miscarriages and serious bleeding if taken during pregnancy. Before taking misoprostol, tell the doctor about taking prescription and non-prescription drugs, especially antacids, aspirin and arthritis medication. High-risk groups are: drug should not be given to pregnant mothers. If prescribing authority justifies the benefits of the drug against the possible damages, he or she should reevaluate them and consult the reference material and previous studies. Now the dosage. The adult dose is 200 microgram. Frequency is 6 hourly. And route is oral. And the brand names are Rotec, Cytotec, and Briki. I hope you liked the video. Please don't forget to subscribe the channel. Thanks for watching.